Hello, I'm Rick Guasco from Positively Aware, and this is the PA Chat, an ongoing series of interviews and discussions about issues and ideas affecting people living with HIV. Last year, when Congress passed the so-called Big Beautiful Bill, it included new rules and restrictions on Medicaid, ranging from expanded work requirements to more paperwork for states to verify people's eligibility. Joining me to talk about how this is affecting people living with HIV is Rachel Klein, Deputy Executive Director of the AIDS Institute, a national nonprofit, nonpartisan organization that works on public policy, education, and advocacy for people living with HIV, as well as people with hepatitis. Rachel, thank you for joining me today.
Thanks for having me.
So let's start off with, what did the Big Beautiful Bill do? What requirements came out of it?
There were a lot of different provisions in that bill. It was an enormous bill, primarily focused on cutting federal funding for programs that serve low-income people and vulnerable people in order to free up federal resources to provide tax breaks for billionaires and corporations. Among those cuts includes a number of different cuts to the Medicaid program that totaled over $1 trillion. It was the largest cut ever to the Medicaid program, as well as cuts to SNAP and other public programs.
There were work requirements already in place. They were expanded, increased. What happened there?
Well, there were work requirements for the SNAP program that were increased, and that's the federal program that provides food assistance to people. And then there were new work requirements that were created for the Medicaid program, and specifically for the parts of the Medicaid program that were the expanded coverage for adults ages 19 to 64. So in those 42-ish states that had expanded Medicaid, just those populations that are in the Medicaid expansion program are the ones who are subject to these new requirements. And I want to just flag for folks that that includes over 40% of people who are living with HIV. Mm-hmm. And in those expansion states, over half of the people who are living with HIV who are enrolled in Medicaid are in that expansion group. So this is really, really important for the HIV community.
Was the age range expanded as well for people who had to follow these work requirements?
No, this was just the expansion for adults is for people ages 19 to 64. So we just want to make sure that people understand that people who are ages 65 and over are eligible for Medicare. Okay. And a lot of people who are over age 65 have both Medicare and Medicaid if they have low incomes. But this is just for the people who are under age 65, but over age 18, who are in that expansion group. So, Congress likes to talk about these folks as being able-bodied adults, right? Or these are adults who, are not part of those traditional Medicaid groups that have historically been eligible for Medicaid because they are not only low income, but they also have a disability or are over age 65 or are the parent caretaker of a dependent child. So they wanted to be really clear in the expansion and also in the application of these work requirements that they're primarily talking about adults who are non-disabled, not parents of young children, et cetera. And these are the folks that they expect are able to complete these work requirements.
And from what I understand, frailty is also a key issue here. What is frailty and who defines it?
Yeah, that's a really good question. There's this phrase that gets used frequently when we talk about, especially within the Medicaid program, but in other public benefits too, when there's sort of new onerous requirements, frequently people who are considered to be quote unquote medically frail are exempted from those requirements. That's also true for this new work requirement. But, what does frail mean is kind of the key question here. And a lot of us think of that as someone who is, feeble or, at risk of hospitalization or in the hospital. And really what we're talking about here is, and Congress sort of defined this too, right? That people who are, quote, medically frail or have special medical needs. So what it really means is just people who have a special need for healthcare. And among those are people who have a disability, or physical disability, have a severe mental health condition, have a substance use disorder condition, and people who are considered, and this is the most important one for our community, people who have a serious or complex medical condition are considered to be folks who have special medical needs or, unfortunately, medically frail. And that's who is supposed to be exempt from this Medicaid work requirement. And what we were hoping is that the states, as they are implementing this, and the federal government, as it was creating rules, would be really clear that HIV is a serious or complex medical condition, and that people who have HIV or living with HIV would just be exempt from this new Medicaid work requirement altogether.
Well, that's tricky because, so what you're saying is that you've got politicians, bureaucrats, and then care providers, and each one's got a different idea of what frailty is and who that covers.
Yeah, and it needs to get defined every time it gets used in a policy context, right? Because it can be really different from program to program and from population to population. And in this case, Congress had included this clarification that people who have a serious or complex medical condition should be considered medically frail, regardless of anything else, and that they should be exempt from this new rule.
Okay.
The administration, however, has a different idea.
Right.
And we can talk about that.
Well, let's elaborate on it. Let's talk about it.
So a couple of weeks ago, the interim final rule, which is also a sort of special kind of rulemaking that, goes into effect when the government says it does. There's, an opportunity for public comment, but they're not necessarily going to respond to those comments, right? They put this rule out because it was required by the statute, and it was required to be issued by June 1. And it was issued on June 1. And we thought that what that rule would do is sort of tell states, here are the conditions that we, the federal government, think should qualify as serious or complex, right? And sort of enumerate what those are or describe that in some way for states. Instead, what they did is overlay a new requirement on top of what is in the statute. And they said, yeah, okay, if you have a serious or complex medical condition that significantly impairs your ability to work, then you can be exempt. So it's this whole new sort of subjective definition of what constitutes a serious or complex medical condition, and, sort of overlays this ability to work into the mix. And of course, we think that that's a really difficult thing for a state government to assess.
Is this public comment period open right now?
It is. Public comments are, they will receive them up until July 31st. So we've got, about 6 weeks in order to draft comments and get them up there. And honestly, I would really encourage people to submit a public comment. It sounds like a really scary thing to do, but really all you have to do is to say to them, I'm a person living with HIV, and this rule is really going to hurt me and people I know, and you need to withdraw it and revise it to be more consistent with the statute. And we're going to be preparing template comments that people are going to be able to use and adapt in order to provide this feedback to the federal government.
Okay, how will people be able to get to those templates?
I don't have them ready yet, but I know we're going to be putting it up on our website. It'll be up on some of our colleagues' websites because we're going to do it through a coalition that we're part of.
Okay, and
So,
what's your website? What's the URL,
yeah,
and who
it
are your
is.
coalition partners?
Sure. It's the AIDSinstitute.org. That's our website. And, we're part of a bigger coalition called the HIV Healthcare Access Working Group. And so there's a lot of different organizations that are a part of that who join us in doing federal policy advocacy on issues that are important to access to healthcare for people with HIV.
So these are HIV advocacy organizations, AIDS United?
That is one of our great partners. And it's great that you mentioned that, because I want to also bring to people's attention that in addition to submitting comments on this rule, we're also urging people to call their members of Congress and their senators, as well as their governors, and to urge them to weigh in with the administration and say, hey, you know what? We passed this law, and what you put in that rule is not what we intended, right? We didn't intend for there to be this extra, functionality test that sort of says, can you work or not? We said people who are sick shouldn't be subject to this rule. That's what we intended. And AIDS United has an action alert on their website, which is aidsunited.org. And it's really easy to find, and it has talking points, it has bullet points, it has links so you can send an email directly to your elected senators and representative, or you can send them, you can click the link and it will help you call them to relay this message. And both of those things are really important because we really think it's important for Congress to be weighing in on this.
And I'm glad you mentioned that because, let's be honest, there are a lot of people out there who don't know who their elected officials are. Who's my member of Congress? Who's my senator? Who's my governor even? But AIDSunited.org makes it easy for people to not only find that out, but also communicate with those public officials.
That's right. So, that's right.
Are there other ways that people can get involved? I remember when we were talking before, you had talked about certain advisory groups that need people.
Yeah. So, Medicaid is a federal state partnership, right? So the federal government sort of provides a good chunk of the funding and they kind of set the ground rules, and then states make a lot of the decisions about how to implement it on the ground, and they operate the programs. And so there is in every state a Medicaid Advisory Commission and a Beneficiary Advisory Council. Now, these are groups that are both created in order to provide an avenue for interested parties and stakeholders within a state to have direct communication with their state Medicaid agency about things like a new Medicaid work requirement. And they have to meet at least quarterly. Many times they meet monthly. And you can go to your state's website and you can, search for Medicaid Advisory Commission, and you'll find a page that has a lot of information about how that commission works and who is a part of it and when their meetings are and how to join the meetings. There's also public comment opportunities at these meetings for people to give a really short, 1 to 5 minute, here's who I am and why, and here's what my issue is, and here's what I think you should do about it. And so it's a really great place to be hearing from your state agency what they're planning to do and how they're going to be implementing this new program. And then also to be able to weigh in with them about decisions that you think they should be making.
And there are no qualifications to be able to do this, right?
No, they're open to the public and anyone can join in. And almost always these are being held virtually, which is great because, I've been able to, and people on my staff have been able to listen in on these meetings that are happening all over the country and get a little bit of a better sense of sort of where states are at as they're thinking about this huge change that they're about to implement.
What else is being done for people living with HIV to navigate through these changes? I'm thinking like case managers. They've got to be pretty busy right now.
Yeah, I think that's right. Right. We already know that case managers are, really busy with a lot of clients that are struggling because of changes to the Affordable Care Act that have made health insurance more expensive, and a lot of other changes that are going on in the system. A lot of states are struggling with the cost of programs. That's only going to increase as these Medicaid cuts go into effect, right? Because the safety net for people with HIV is obviously Ryan White, right? But also it's Medicaid and the Affordable Care Act. And I guess, this is as good a place as any to say, the Medicaid program, as I said, 40% of people with HIV are enrolled in Medicaid. Medicaid pays 45% of all federal funding for HIV treatment. That's 5 times as much as is allocated to the Ryan White program every year. So this is it's going to have a huge impact on Ryan White programs because when people lose Medicaid, they're going to be coming uninsured to Ryan White as a backup when they need to look for another place to get their medications, right, and treatment. And so, caseworkers, I think, are really going to play a crucial role in helping their clients stay connected to health insurance, whether it's Medicaid or the Affordable Care Act coverage. And then are going to have to, and I think that's going to be a lot of extra work for them to help their clients navigate these new requirements. The other big change that's coming to Medicaid is that there's going to be renewals for this expansion population every 6 months. So instead of annually, people are going to have to sort of do these check-ins with their state agency every 6 months. And I think just because these systems are going to be so complex, and they already are, it's really going to be up to caseworkers to be providing support to their clients to help them navigate this so that they don't lose their coverage for some administrative reason.
Wow. It's crazy to hear how you have Medicaid being cut, all these restrictions and paperwork requirements being added, and at the same time, that's going to cause more stress, more demand on Ryan White services, when we both know that Ryan White funding has more or less been flatlined or just level funding for many years now. So you've got level funding and at the same time an increase in demand. Something's got to give here, right?
Yes. And we're already starting to see the impact of that because of increased cost of health insurance premiums in the Affordable Care Act that happened this year. We're starting to see ADAP programs make cost containment decisions that include everything from reducing eligibility levels to taking medications off of their formularies, and even a couple of states that have created new wait lists, which is something that, we haven't seen since the ACA went into effect in 2014.
Positively Aware has been reporting on what's been happening in Florida, Missouri, Texas, but we know that many other states, and here in Chicago, I was surprised to find out that Illinois will soon have a waiting list for ADAP.
Wow.
And it's astonishing to hear because this is only going to continue, if not get worse, let's be candid, in the years ahead. Yeah. So all the more reason why advocacy and contacting your public officials is going to become more important. But also, from what you were saying about these advisory councils, is that it's important to make your voice heard in that way. Insinuate yourself into the fabric, into the mechanisms of these organizations so that you can have a voice in that area as well. Am I correct?
Right. That's right. And I think, as Medicaid agencies have been trying to figure out how to implement this new, all these new systems that they have to put into place because of I call the HR1, I can't call it the big whatever bill. But anyway, as they are putting all of that into place, they've been really open, I think, to input from community members. And it's been really helpful, there's one state that has already started to implement the work requirement earlier than they had to. That technically it goes into effect on January 1, but Nebraska started early on May 1 of this year. And in its early, implementation, has been really reaching out to different communities within the state to get feedback. And they developed a very long list of diagnostic codes that they felt represented serious or complex medical conditions that were going to exempt people from this new requirement. Because, remember, they established this based on our understanding of what the law actually says instead of what this new rule says. And so, as they were developing that, they sort of said, hey, here's our list of codes. If you think we're missing some codes, let us know. And so we were able to, provide them feedback and say, hey, you've got one really important HIV related diagnostic code here, but there's a lot more of them, and you should include more of those on your list, right? Mm-hmm. So I think states are really, they welcome that feedback, and they need to hear it because the Medicaid populations are so diverse, right? Mm-hmm. And what different people need in different areas of your state, in different, demographics of your state are so different that they really need to hear from people what's important.
Is there anything else that people should know or that you want to add?
Yeah, I think there's a couple more things. One is that, I want to just sort of spend a minute talking about what this work requirement is.
Yes.
Because I think because there are going to be people in our community who are going to have to demonstrate compliance. I hate using those words too, but it's kind of the, policy phrasing. But there's going to be people who are going to have to show that they actually met this new requirement. Because a lot of people who are living with HIV can and do work, right? And so if you're already working, it's going to be really hard to show that you can't work. So, people are going to have to do this. And so what the requirement is that you have to show that you're either working or going to school or volunteering at least 80 hours a month, during your certification period, that 6-month window between certifications. And states get to choose whether that is every single month or 3 of 6 or 1 of 6. And in a lot of states, they've actually been picking 1 of 6. So you have to show that but you have to know what the rules are in your state. But in a lot of them, it's going to be for at least one of those months, you were able to meet that 80 hours, or you were able to earn more than $580 in that month. And that is basically 80 hours of work at the federal minimum wage. So if you're living in a state that has a higher minimum wage, it won't necessarily be 80 hours as long as you've earned that $580. So that's what it takes to sort of meet the requirement. Then there's going to be a process to demonstrate that you met the requirement. And that's going to be different in every state. But they are supposed to use as much electronic data as possible that's sort of available to them without bothering you. They can check all of their state systems and say, oh, we have wage data that shows that you have earned what you need to, and therefore you don't have to do anything more. But that's going to vary state by state. So it's really important to know what the rules are, and to make sure that the Medicaid agency, if you're a Medicaid enrollee, has all of your information up to date. They know how to reach you. They can send you, a letter at your address. They can call you on your cell phone or send you an email if you have that ability. Or if you know someone who is on Medicaid who is unhoused or not stably housed, that, they have some address that they can provide where they know they can receive mail is going to be really important as all of this starts to unroll. So that was one of the things I just wanted to, just make sure that people are aware of. The other thing is, when you are calling, who I hope you will be calling your member of Congress and your senator. But when you make that call, also ask them to increase funding for Ryan White, right? Because that is one of the ways, probably the most important way that we're going to be able to combat that issue that we were talking about earlier, where, Ryan White programs have been relatively flat funded for a long, long time, and are now really going to be pressed for funding, is we need Congress to say, no, it's time for Ryan White programs to get an increase, and particularly for ADAP, but, for Ryan White across the board.
Yeah, in fact, can we talk about the budget process right now that Congress is going through? Because my understanding is that you've got Ryan White funding. There are proposals to cut Ryan White funding. There are proposals to cut HIV programs through the CDC, at the FDA, the National Institutes of Health. None of this is a done deal yet, which is the hopeful thing. But the scary thing is we are talking about tens, if not hundreds of millions of dollars that are being talked about, cut from HIV. So what's going on with that?
So, this is an election year, which makes the budget process dicey always. And, I think, as folks know, the budget process in Congress has not gone very smoothly for quite a while, right? So right now, both the House and the Senate are debating what they think the budget should be for next year. Thus, the House is a little bit further along in that process than is the Senate. So the cuts that you're talking about that have been proposed in the House. And we haven't seen yet what the Senate is going to do. Usually in the past several years, the Senate bill has been much better for HIV programs than the House bill. So what's going to happen this year, since it's an election year, is that what we're going to see come out of the House is probably going to be really bad, right? And we're not sure yet what the Senate bill is going to look like, but we hope it will be better. And then sometime before all of everybody on the Hill leaves to go home to campaign, in October, they're going to pass a continuing resolution, which basically just means we're going to keep funding the government, at current levels until some future date that they'll decide in their bill, right? And then they're going to come back next year, either in December after the election or early next year when there's a new Congress, and start this process sort of all over again. I guess what that means is at the end of the day, call your member of Congress, call your senator, make sure they know that their constituents support increasing funding and oppose cuts to HIV programs, and then keep doing that, right? Because we don't know what Congress is going to look like next year yet. And this process is going to be dragging out for quite a while. So, weighing in with your member of Congress is not like voting, right? You should do that too. But we do that once. When you're making these calls to tell members of Congress what you think, you can do it every single day. You can do it all the time. And the more the merrier, because the more that we want them to be tired of hearing from you. Yeah,
that's a very good point. And you also got me thinking about, we don't know what Congress is going to look like. I know that a lot of people are thinking, so many people are upset with politicians right now in certain political parties that they're going to be more Democrats, and so we're going to be safe if we get more Democrats into office. Can we really make that assumption?
Well, the AIDS Institute is a nonpartisan organization, so but what I can say is the federal budget is large and complicated, and the squeaky wheel gets the grease. So no matter who is in power, it is incumbent on us to make our voices heard, right? If you are not weighing in, then you're not going to be remembered when it comes time to finalize these budgets. And we want to make sure, especially now, given all of the budgetary pressures that our states are under, that our communities are under, that we need the federal government to devote the resources that are needed in order to continue with the progress that we have made with coming to an end to the HIV epidemic. We need to continue that progress, and it's going to take money to do that.
Regardless of party affiliation, every member of Congress, every politician, you can't make the assumption that they're automatically going to be on your side. That's why education is so important. And it's not just educating the elected official, it's educating their staff. Because
That's right.
they're the ones who do so much of the legwork, the homework for the elected official. So it's about educating that staff member in that political office to let them know why this matters to the people back home and how it affects the people back home.
That's right.
So once again, this is why advocacy is so important for people living with HIV.
That's right. We have to make our voices heard.
Exactly. I'd like to go back, if we can, yet again, to the work requirements.
Mm-hmm.
A couple of concerns that came to mind are, what about people who, if they're worried about 80 hours a month, that's the requirement they need to meet. Some people don't have control over how many hours, their hours get cut or reduced.
Right.
What happens to those people? They've got to be worried.
Well, I think that's going to be a real problem, right? Because there are so many things that we don't have control over, right? And that are so subjective in all of this. If you're a gig worker, if you are a shift worker, if you have a job that requires in-person presence versus, on a Zoom like you and I are doing, if you have a job that requires a lot of physical labor that, you can't perform when you're sick, or that doesn't have leave that you can take when you are sick or have to go to the doctor, then that makes that job much riskier. And so I think that, all of these are what make this requirement so onerous, so subjective, and really so dangerous for people with HIV, because we know that having consistent access to treatment is what keeps people healthy enough to participate in the workforce, right? And so, what this rule does is it really puts people in a terrible position where if they aren't able to consistently meet the work requirement, and it's for reasons other than their condition making them unable to work, any of these things that we were just talking about, then they may, despite trying really, really hard, end up losing their access to treatment. And we know what that means, right? That puts people in a very, very scary position. So, that is the reason that we think advocacy is so important. A Medicaid work requirement doesn't make sense in my mind ever, but if there is going to be one, it needs to exempt people who are living with conditions like HIV, where that connection to healthcare, which is the whole point of the Medicaid program, is so crucial that losing that access is going to put their life in jeopardy. We need to make sure that, this gets overturned.
I guess it's fair to say that policy has to be compassionate, and it has to understand that one checkbox does not fit all.
That's right.
And that's the nature of your work at the AIDS Institute, I'm sure.
There's always more work to be done. And we're here to keep doing it and fighting the fight, and always like to partner with others and to support the voices of people who are living with HIV across the country. And, we'll look forward to continuing to do that with you.
And so it goes. Rachel Klein is Deputy Director of the AIDS Institute. Rachel, if people want to know more about the Institute, where can they go?
Well, they can go to our website, theaidsinstitute.org. You can also find us on social media. We have channels on LinkedIn, on Facebook, and on Instagram. And I hope you will look for us.
Most excellent. Thank you, Rachel. If you like this video, be sure to tell someone. Like us and subscribe to the Positively Aware channel here on YouTube for more interviews and more health news about HIV. For the PA Chat, I'm Rick Guasco from Positively Aware. Thank you for watching.